talked about, but it's covered in our book, chapters 6 through 8, which demonstrates that the evidence that fluoride actually works from swallowing, from water fluoridation, is extremely weak indeed. It's very little. At best, it's a saving of 0.6 of one tooth surface out of 128 tooth surfaces in a child's mouth. So it's a minuscule saving, and certainly does not warrant the health risks that I've talked about, well, particularly the brain, but there's also the bone damage, arthritis, hypothyroidism, and all the other things. And we're not saying, when you read the book, we're not saying that all these things have categorically been proved, but what we're saying is that the studies which have been done, which shows that these things occur at high doses or moderate doses, there's no adequate margin of safety to protect everyone. This is not a practice which should be forced on people. If you can't demonstrate a really strong benefit, and there are huge questions about the risks involved, it's not something that should be forced on people. It's arrogance. It's the most arrogant public health policy that's ever been perpetuated on the American public.
Bottom line is that fluoridation is approved in each state in the United States, and it's separately approved in each country of the world.
No. Look, let's get the numbers right. There are about 30 countries that have some fluoridation.
Okay.
Only 8 have more than 50% of their population drinking fluoridated water. Japan doesn't fluoridate, India doesn't fluoridate, China doesn't fluoridate, and the most of Europe, 98% of Europe, does not fluoridate. Yet you can't see a difference in tooth decay. So most people in the world do not drink fluoridated water. Nearly half the people that are drinking fluoridated water live in North America. This is largely an Anglo-American practice.
I'm aware that there's a dental crisis and that a lot of this has to do with low-income families. They don't have the capital to go to better dentists. Will you explain it?
Well, it's really, that one of the most emotive arguments for water fluoridation is that it's supposed to help poor kids. And it's absolutely true that most of the tooth decay in the United States and other wealthy countries is located in low-income families. But this is they've got it absolutely backwards, because by putting fluoride into low-income, for low-income families' water, they can't afford to avoid it. So you've trapped this subset of the population. Low-income families are trapped. And number two, we know that fluoride's toxicity is greatest when you've got poor diet. And you're more likely to find poor diet in low-income families than in middle-income families. So you've trapped them, and they're more vulnerable. We also know, incidentally, that communities of color, Afro-Americans and Hispanic children, are more sensitive to dental fluorosis for whatever reason. The dental fluorosis rates amongst Black and Hispanic children are greater in the same community as the dental fluorosis in white children. So you've trapped this community, and where that coincides with low income, you've trapped those communities, and they're more vulnerable. So it's not equitable at all. And yes, we have newspaper report after newspaper report talking about a dental crisis in cities like Pittsburgh and Cleveland and New York City and Boston and other Cincinnati, which have been fluoridated for 20 or 30 years. So why are we getting a dental crisis in these cities? And the answer is because tooth decay is in low-income families, and fluoridation does not help these low-income families. And in fact, the real problem of tooth decay in low-income families is that 80% of American dentists do not treat children on Medicaid. And therefore, it's crocodile tears. When they come forward and say, we've got to fluoridate to help poor children, well, if you really want to help poor children, then find a way of getting American dentists to treat dental decay in poor children when they've got Medicaid. These are crocodile tears on this front. But what we should be doing is to stop fluoridation and use that money to set up dental clinics in areas of low income, and combine the education for a better diet, not only to fight tooth decay, lower sugar especially, but also to fight obesity. And I then think this investment in dental health and holistic clinics to look after the the physical side of people in poverty would pay huge dividends. It's going to cost this country billions, if not trillions of dollars in the future, treating the diabetes, which is results from obesity. And diabetes now in teens, teens are getting type 2 diabetes. This is going to cost the country trillions of dollars over the next 20 or 30 years. So it'd be well worth our effort to take all that money being squandered on fluoridation chemicals, fluoridation equipment, fluoridation promotion, fluoridation research, and put it into prevention through education, better diet. And if indeed one of the prevention strategies is using fluoridated toothpaste, although I prefer xylitol toothpaste, if that was there, then that was where the money should go. Make sure that poor families have free toothbrushes, free toothpaste, but certainly education. We need education, not fluoridation, for the health of our children.
Ladies and gentlemen, we have been talking with, learning from, and listening to retired Professor Paul Connett, the leading author of The Case Against Fluoride, How Hazardous Waste Ended Up in Our Drinking Water, and the Bad Science and Powerful Politics That Keep It There, and the director of the Fluoride Action Network. Paul, thank you for your dedication and your many, many years of focus on this subject.
Thanks, Kim. It was very nice being on your program. It's a delight being interviewed by someone who's actually read the book.
Thank you very much. Thank you for all of your hard work.
You bet.
Bye-bye.